from you. Are you in a similar situation where you due to have an operation or due to see a doctor this week and had to be cancelled? 85058 is the text number, and if you want to WhatsApp us, you can send us a voice note on 08085 909 693, or you can tweet us at BBC5 Live. Dr Arjan Singh is the chair of the BMA's North Thames Regional Doctor Committee. Morning to you, Dr Arjan.
Good morning, thank you.
You're on the picket line in London today. What's it looking like out there?
It's looking really good. We've got a lot of support, and doctors are taking to the pickets en masse across the country.
First, do no harm is a phrase you'll be familiar with, is the, I guess, the bedrock of what it means to be a doctor. So this must have taken quite a lot for you and your colleagues to decide to do this.
You're absolutely right. No doctor wants to go on strike. It's not something we've been thinking of. We've been dreaming of this career for myself since the age of 5 or 6. We don't dream of going on strike. And to all patients that are having operations and clinic appointments cancelled and delayed that they've been waiting for months already for, we are so sorry. We are, as doctors, we are patients ourselves. My family members are patients, and they've been affected by these strikes. But we've been pushed into this because Steve Barclay is unwilling to meet with us. He's unwilling to negotiate. And the frustration that the public and your listeners will feel with the health service, believe me, we share the exact same frustrations. It is soul-destroying going into work at the moment and not being able to offer the services that this country deserves, the people deserve, because we're chronically understaffed, because this government continuously and vociferously cuts the wages of doctors. And we're trying our hardest, but I'll be honest, we're drowning. We're 9,000 doctors short. The ones that remain, 40% want to leave. And it's a shocking statistic, but because of the lack of doctors and the lack of resources, there's 500 people in our NHS, 500 British people dying needlessly every single week due to these factors. That's a Boeing jet. And we're telling Steve Barclay, we've got the solution to the retention crisis, and it's £19 an hour. That's what we're asking for. For a junior doctor with £100,000 of student debt, who's the first port of call for 200 patients in the middle of the night, £19 an hour. If you can agree, Steve Barclay, that we are worth £19 an hour, we will stop these strikes. But so far, we've tried to meet with Steve. The first time, he told us, I don't have permission to negotiate with you. The health secretary of one of the largest countries in the world did not have permission to negotiate with one of the largest healthcare unions in the world. And in the second meeting we had recently, we laid out our opening position, which is how any negotiation since the dawn of time has begun, with one side telling the other what they would like. And we told Steve Barclay we would like full pay restoration. And instead of giving us a counteroffer, Steve Barclay walked out of the room. And then he went to the media and he misrepresented and lied about what he said, and said that we had put out preconditions, but that's not true.
Okay, we did ask for a member of the government to talk to us this morning. They didn't have anyone available for that. The Health Secretary, as you say, Steve Barclay, had said that he'd hoped to begin formal negotiations with the BMA last month, but because of that demand of 35%, he's saying that that's unreasonable. Is there any movement in that, Arjan? Is there any movement in that number of 35% so that this potentially could be called off?
So at the moment, we actually want Steve Barclay to give us an offer at the moment. He hasn't even done that. And in terms of our demand, it's pay restoration. So it's to restore our pay to the level it was in 2008. But we should probably contextualise that into pounds and pence, which is unfortunately the only language the government seems to understand. But what we're asking for is for a junior doctor to have their pay restored from £14 an hour to £19. Now, the total cost of that is approximately £1 billion. We should contextualise that as well. We spent £37 billion on track and trace, £4 billion on PPE that never saw the light of day, and we spend £3 billion on agency staff in the NHS, which is even more crazy. And the economic argument is sound, and I think the question we need to really be asking ourselves is what happens if we don't restore the pay of doctors? We're already seeing a mass hemorrhage of doctors to Australia, Canada, and New Zealand. We already have 500 patients dying a week as a result. Is it realistic to expect a first-class healthcare service if you continuously cut the wages of the staff that work in the service? No.
I'm assuming, Arjan, it's not just about money, because the conditions that you've spoken about, we've heard over the past few years about how difficult it is because of the amount of doctors that the NHS is losing. Mm-hmm. So At what point here do you say, right, okay, I've got enough? What's the percentage? You have a figure in mind that says, actually, I just feel as though we're being valued now. And do you feel as though you're any closer to that? Because a lot of people, realistically, we've got lots of people texting into the programme saying that they're worried about this. They're concerned about what happens if they get ill, if they get sick, and there's no one there to take care of them, or not enough people to take care of them safely.
So, in terms of a specific number, as I'm sure you can appreciate, we're not going to negotiate live on radio. We just want Steve Barclay to come to the table and to give us a credible offer that we can take to our members. And if our members are happy with it, then this whole thing is done. But he's not actually coming to the room. He told the media and he told us that our opening position was a precondition, but that's not true. So either Steve Barclay doesn't know the difference between a precondition and an opening position, or Steve Barclay, the politician, is being dishonest. Okay. And we've extended the olive branch again. And we said, we'll meet with Steve Barclay today, tomorrow, Wednesday, Thursday, Friday, wherever you want. We'll meet with you, Steve. But come to the table and negotiate. And then yesterday we found out that Steve Barclay has been meeting up with the Ministry of Sound, nightclub owners, as many times as he's met up with the BMA. Okay. This is the Health Secretary.
Dr. Arjan Singh, thank you so much for your time. We've got to leave it there, but we appreciate you taking the time to speak to us this morning.
Thank you very much.
Dr. Arjan Singh, the chair of the BMA's North Thames Regional Junior Doctor Committee. As I mentioned, the Health Secretary, Steve Barclay, who Dr. Arjan was mentioning there, said he'd hoped to begin formal negotiations with the BMA last month, but the demand for a 35% pay increase was unreasonable. It is 8:15.